Malaria is a disease caused by the parasite or genus Plasmodium, which is carried by mosquitoes, specifically the female Anopheles mosquito. There are 5 known species of Plasmodium parasite. We have Plasmodium falciparum, which causes malaria known as malignant tertian malaria. Then Plasmodium Vivax, which causes tertian ague or benign tertian malaria. We have Plasmodium malaria, which causes quartan malaria. Plasmodium ovale, which causes mild tertian malaria. And Plasmodium knowlesi. And then later on in the video, we're going to explain what each of these names of the different types of malaria signify. Okay, so let's go over to the life cycle of Plasmodium species. In the course of reading, you may have seen things like sporozytes, schizonts, merozytes, trophozytes, ring stage. I'm going to explain the meaning of all that here. And then I'm going to highlight some key points in each of the different species. But if you really want to go into details, I could do that in a separate video. So let's begin. An infected female Anopheles mosquito contains sporozytes of the parasites, which are just asexual forms of the parasites. When it sucks the blood of a human or animal, these sporozytes are injected into the body. Some may be killed by macrophages on the skin, others may find their way into lymph nodes, and others will enter a blood vessel. Those that enter the blood vessel will reach the liver. The sporozytes in the liver would mature into schizons. What are schizons? They are heaps containing thousands of merozytes, and again, just like sporozytes, merozytes are also just asexual forms of the parasites. So, the mature schizons rupture to release those merozytes into the blood. Note that in P. vivax and Ovale, not all the sporozytes will mature into schizons immediately. Some of them remain dormant in the liver. We call those ones hypnocytes or sleeping animalcules. Their purpose is to remain there and then maybe wake up one day, months or years after a person has been treated of malaria and cause the person to have malaria again. This is known as a relapse. Okay, just to recap everything we said. An infected female Anopheles mosquito injects sporozytes into the body. They enter the liver. Some mature and some do not mature immediately in particular species. So the ones that mature form schizons, and the mature schizons rupture to release merozytes into the blood. This first stage I have just discussed is called the exoerythrocytic stage, meaning outside red blood cells. Okay, so let's move on. The released merozytes find their way to a red blood cell and infect it. In the red blood cell, they pass through 3 stages: ring, trophocytes, and schizons. To make the red blood cell more suitable for them to stay, the merozytes form a ring structure. Then they multiply rapidly and are called trophocytes. Having multiplied, they come together to form a heap. As we know, these heaps of merozytes are called schizons. These schizons rupture to release those new merozytes into the blood, causing hemolysis of red blood cells in the process. The new merozytes then go to infect other red blood cells. On entry, they undergo the same stages. They form a ring-like structure, then they multiply and are called trophocytes, and then they form a heap called a heap of merocytes, and then these schizons rupture to release new merocytes into the blood. So the merocytes undergo three stages: the ring, the trophocyte, the schizons, and then they release new merocytes. This growth of merocytes is fueled by hemoglobin, which they feed on and digest to produce hemosin, the malaria pigment. The alternate mature and release of merocytes is periodic, meaning that it repeats over a specific period of time and is responsible for the fever paroxysms characteristically observed in malaria infection. In P. falciparum, Vivax, and Ovale, the paroxysms recur every 48 hours, hence the Roman name tertian is common among them, representing an interval of 2 days. In P. malaria, the paroxysms recur every 72 hours, hence the Roman name quartan, signifying an interval of 3 days. Okay, let's move on. However, not all merocytes mature to form schizons. Some of them divide by meiosis to form something called gametocytes. The gametocytes are non-pathogenic. Their role is simply to ensure that malaria keeps existing, mostly in the tropical parts of the world, because when an uninfected mosquito bites a person with gametocytes, the gametocytes enter the gut, then they mature into gametes and fuse to form a zygote. The zygote then develops into a motile ookinet, which penetrates the peritrophic membrane or the midgut of the mosquito. From there, it enters the hemocell where it forms an oocyst. The oocyst matures within 2 weeks to release sporocytes. These sporocytes then find their way to the salivary glands of the mosquito, and hence when that mosquito bites a person, the sporocytes will be transferred into their body. Hence, the cycle will go on and on. This is what happens on the inside when a person becomes infected with malaria. Here are some key points on each of the different species of malaria. Falciparum malaria is the most dangerous type of malaria because it infects all kinds of red blood cells, while Vivax malaria is the most common and it infects only young red blood cells. P. malaria infects old red blood cells. Recrudescences are common in P. falciparum and P. malaria, while relapses, as I have previously explained, are common in P. vivax and Ovale. And the difference between a recrudescence and a relapse is that a recrudescence is a repeated attack of malaria due to survival of the parasite in the red blood cell, while a relapse is a recurrence of the disease after it has already been cured due to reactivation of hypnocytes. In P. falciparum, infected red blood cells have irregular granules called Mora's clefts. You can remember that Mora's clefts are for falciparum malaria because they both have the letter M, while in P. vivax, infected red blood cells develop smaller dots called Schuffner's dots. Some symptoms of malaria include fever, headache, and anemia because of the constant destruction of red blood cells. Some complications typical in falciparum malaria are pulmonary edema, accumulation of fluid in the lungs, hemoglobinuria, which is hemoglobin in the urine, hypoglycemia, low blood sugar level.